Hey, what's up everybody? Welcome back to my YouTube channel. Today's video, we're gonna talk about colposcopies. So just a little bit of a background in case you haven't seen my previous video where I talk about pap smears, exactly how we do them, and I explain all of the different results that you might see with a pap smear. This one's gonna be a part 2 to this video because if you have an abnormal pap smear, you may end up needing a procedure called a colposcopy. So in today's video, I'm gonna be explaining the whole process of a colposcopy, how we do them, and I'm super excited about this video because I'm also going to share a little behind the scenes of what it actually looks like to get a colposcopy. I'm gonna show you exactly the procedure room that I use to do colposcopies in my office. I'll get to show you the colposcope, the instruments we use, the whole process, so that in the event that you do need a colposcopy, you could watch this video, feel a little bit more prepared and a little less anxious about having a colposcopy done. In case you're new here and you're new to my YouTube channel, I am Dr. Allie, I'm an OBGYN, and here on YouTube I talk about all things women's health. I share vlogs about what my day-to-day looks like as an OBGYN. We talk about pregnancy and periods and literally everything in between. If you're not already subscribed, I would love it if you would join this family here on the internet. So go ahead and hit that subscribe button so that you don't miss one of my new videos. So as I mentioned earlier, if you haven't seen my video where I explain pap smears and the results, I highly recommend that you go watch that video first so you have a better understanding about what it means to get a colposcopy or get biopsies done. I'm gonna leave that video link down below so that you can check it out. If you prefer to read that information rather than watch another video, I actually wrote an entire blog post about pap smears and their results over on my blog. I write my blog in Spanish and in English, so I'm gonna leave that blog post linked down below as well. All right, so let's go ahead and get started and let's talk about colposcopy. So you all know I like to start my videos with a little definition and background. So the process that I'm gonna discuss today is colposcopy. Here in OBGYN land, we love to shorten everything. So you might hear me say the word colpo, and that's just an abbreviation and a shorthand, but the full word is colposcopy. So what exactly is a colposcopy? It's a way of looking at the cervix through a special magnifying device called a colposcope. This colposcope shines a light inside of the vagina and on the cervix. A colposcope can greatly enlarge the view. So think of like zooming in a camera where you can get really close and see much more detail. This is exactly what a colposcope does. It allows us to be able to zoom in on the cervix so that we can see any abnormal areas or concerning areas better than with our naked eye. So why are colpos done? When results of your pap smear, again, watch that video, are abnormal, that's when you might need to have a colposcopy done. A colpo can provide us with more information on the actual cells of the cervix. It allows us to get more details as to changes that are going on with the cells of the cervix. It also allows us to look for things like genital warts may be present on the cervix, or maybe someone has cervicitis, which is an inflammation or irritation of the cervix. People might have benign growths or polyps coming from the cervix. The colposcope will help us see these things better. So how do we do a colpo? It's typically done at your OBGYN's office. And like I mentioned earlier, I am gonna give you a little tour of what our procedure room looks like where we do colposcopies. Now here's a couple tips in case you do have to have a colposcopy. It's typically best done when you're not on your period. That way we can truly see the entire cervix and that there's no blood that may be blocking some abnormal cells. Now if you're on the tail end of your period and it's just kind of that old darker blood that's finishing up, that's okay. We just don't want it to be the first start of your cycle where it's a lot of heavy bleeding. Now other tips, the day before your colpo, make sure you don't douche, and you really shouldn't be doing any sort of vaginal douching anyway, but just to be safe, I'm gonna say it, no douching the day before your colpo. Another thing, don't use any sort of vaginal medications before or suppositories, and don't have sex the day before your colpo. So this is how we do a colposcopy. Similar to when you have to have a pelvic exam done, you will lay down on the exam tables and your feet go up on the footrests. We will then use a speculum like this one. It's inserted inside of the vagina, and once opened, it helps retract the vaginal tissue to the side so that we can get a clear view of the cervix. Then we will apply a mild solution on the cervix with the use of this giant cotton swab or giant Q-tip. And the solution that we use is actually acetic acid or vinegar, which I know sounds crazy, But when vinegar is applied to the cervix, it pulls out and draws out any sort of abnormal cells on the cervix so that we can better see them. The colposcope is then just placed outside of the vaginal opening. We then can adjust the colposcope so that we can get a clear view of the cervix. So does having a colpo done mean that you have to have biopsies done? Not necessarily. During the colpo, if we see any areas that are concerning, or maybe after we applied the acetic acid or vinegar to the cervix, there's some areas that really look concerning, then we want to biopsy those areas. A biopsy is when we use a special device to actually take a portion of those abnormal areas from your cervix. It's then sent off to the lab so that they can look at that tissue and make sure there's no precancer or cancer cells present. This part of getting a biopsy done may be a little bit uncomfortable. Now, everyone perceives pain differently, so I've done colposcopes where women don't even notice that a biopsy is done and feel no pain. Then I also have other patients that experience some mild cramping. So everyone's gonna be a little bit different. After we're done looking at the cervix, we may or may not take some biopsies. The last step that's pretty typical during a colpo is to do what's called an endocervical curettage. That's just a fancy way of saying that we take some cells from deeper within the canal of the cervix. Think of this as a more deeper and more detailed pap smear. Now this part can be pretty crampy. It's usually not sharp shooting pain by any means, but it can cause some mild cramping. Again, everyone's perception of pain is a little bit different. So what's the recovery like from a colpo? If you don't have any biopsies taken, you should feel fine right away. Similar to when you go for a yearly exam, you have a pelvic exam and a pap smear. You should just return to normal daily activities without any restrictions. But again, remember, everyone's different. If you have biopsies done, then you may experience some cramping, maybe for 1 to 2 days. Usually over-the-counter medications like ibuprofen, Advil, Tylenol help with these mild cramps. You might have some spotting or bleeding after having a colposcopy with biopsies done. And sometimes we use a solution called Moncels, and this is a solution to help stop any bleeding from the area where we took biopsies. This can cause a little bit of an abnormal discharge, maybe dark brown, almost like coffee grains. So you want to make sure and wear a pad so that you don't stain your underwear. But ultimately, you want to ask your personal OBGYN what things you should be expecting and what things are abnormal and what to do for follow-up. Your OBGYN might recommend not having sex for X amount of days or maybe not using tampons. So always make sure to ask. All right, so that's the end of the explanation portion of the video. Now I want to take you behind the scenes where I filmed our procedure room that I use to do colposcopies. I'll show you what the colposcope looks like and the whole setup of everything. So in case you need to have a colposcopy done, you might feel a little less anxious and a little bit more comfortable knowing what to expect. Hey, what's up everybody? I know you just got done watching the video all about colposcopy. I am now sitting in our procedure room where we do colposcopies. Let me take you on a little tour, show you everything so that in case you do have a colposcopy scheduled, you'll be a little bit familiar with the instruments, the colposcope, and everything like that. Now keep in mind that every office is a little bit different, but overall, instruments don't really change that much. So here is the entrance to our room. This is obviously where the patient would be. This is where I would typically sit on the stool. And this is the star of the show, the colposcope. All right, now I want to give you a little bit more information about the colposcope because I know it can look intimidating and really big, but like I mentioned in the video, it really is a way for us to be able to look at your cervix closer. So think about it as like a zoom in on a camera where you're able to hold it farther away, but with these lenses, I can really zoom in and look at the cervix. So I'll walk you through it. You come to your appointment, the MA or nurse gets you checked in, you sit down, you sign your consents, then I would come in, explain to you exactly why we're doing a colposcope, what the recommendation is, go over your results of your pap smear, etc., etc. Then you would sit down on the exam table. Most exam tables have the footrest kind of hidden down below, but there's one. You sit down on the exam table and then it's time to start the exam. A speculum is then inserted in the vagina so that we can get to your cervix. So I have my model here and this is our point of view as OBGYNs. You have the labia majora, the labia minora, and the opening to the vagina. That speculum is placed inside of the vagina because what we want to see is that cervix. If you look through there, the pink tissue that you see right there, that's the cervix and what we're trying to see. So picture this, patient's up in the stirrups. Then in order to use a colposcope, we will bring this over and place it right in front of the vagina. Then with the use of the lens, we're able to really zoom in and focus in on the area that we need to see. Next, we want to make sure and coat the cervix with acetic acid or vinegar because the vinegar is going to show us any sort of abnormalities on the cervix. Now, as I'm looking at the cervix, if there's any area of concern or that looks abnormal to me while I look through the colposcope, then that's when I take a biopsy. After we take the biopsy, then we might want to do an endocervical curettage, where it's kind of like a deeper pap smear so we can get some of the cells from inside of the cervix. After that, you're all done. I hope this video made you a little bit more comfortable about having to get a colposcopy. I also hope it helped educate you on what a colposcopy is and why we recommend them. All right, so that brings us to the end of the video. I hope you guys enjoyed it. I hope you liked kind of seeing a little bit behind the scenes. And as always, I hope you learned something new. So if you personally have to have a colposcopy done, I hope that this helped you. If you know someone that had to have one or needs to have one, please share this video with them so that they might feel a little bit more empowered and educated on the whole process. As always, I'm gonna leave linked down below all of my social media, TikTok, Instagram, and my blog, which I write in both Spanish and English. If you guys aren't already subscribed, please go ahead and hit that subscribe button so that you won't miss any of my new videos. I would love it if you became part of this family. If you guys have any other questions or have suggestions on topics that I should film, please leave them linked down below. I'm thinking I should probably also film a video on LEEPs. So if that's something that interests you, let me know. Thank you so much for being here. I love you guys. As always, remember to be kind and show love to everyone around you. I hope you guys have an amazing week, and I'll see you in my next video. Bye.